My name is Sharlene Parmley, and I am a certified clinical nurse leader practicing at Spartanburg Medical Center in Spartanburg, South Carolina. I am a graduate of the CNL program offered through the University of South Carolina Upstate. Being a clinical nurse leader has been the most rewarding role that I have ever had. I have learned so much while I've been in this role. I've been a CNL for about a year now, and I've had the opportunity to work with individuals in different departments and all across the hospital, and every day I learn something new. This role has given me just a completely different perspective of healthcare that I didn't have as a bedside nurse. And so it's really just opened my eyes to so many new things. I've had the opportunity to work on many projects, some on the microsystem or unit level, and now I'm starting to get into projects that will affect our facility as a whole. So one of the early projects that I had was looking at hospital-acquired pressure injuries on a surgical unit. And so I met with the nurse manager, the unit educator, and the charge nurse of this unit, and we all collaborated and just kind of threw out ideas based on things that we had seen on the unit. And so I suggested doing a 2-person skin assessment on admission just to see if it would make a difference. And so we all agreed to give it a try. And so the next step was to develop education around this process. And so we used the unfreeze, change, refreeze model. And the unit educator and I collaborated with our wound team leader to develop education that we then shared with nurses and also with the PCAs on the unit. The education was tailored slightly for the PCAs, but overall they received the same education. We talked about the Braden scale. We showed photos of different skin issues and talked about how we would treat them. So we looked at things like yeast, we looked at fungal rashes, we looked at different stages of pressure ulcers, things like that. We also talked about the available skin products that we had within our facility and how to use them effectively. We also showed nurses how to offload correctly. We reviewed our skincare policy that was currently in place. We talked about different available resources throughout the hospital. We provided tips on how to do a head-to-toe assessment, and all of this was to help the nurses perform the best head-to-toe skin assessment together. So we now call this the buddy assessment. To go along with this, we also showed nurses how to co-sign that buddy assessment in the electronic medical record. And so after putting all of these things into place and providing this education, we've seen a decrease in our hospital-acquired pressure injuries on this surgical unit by about 75%. And this is compared to 8 months prior to initiation. And so we started this process back in April of 2019. And so our rates have just continued to improve. So we have celebrated this several times with ice cream parties and things like that, just to kind of say thank you and just to help staff realize that their efforts are really making a difference in the lives of our patients. This project would not have been successful if it were not for the collaboration with the unit educator and buy-in from the charge nurse and the nurse manager, and also the great feedback and education that we received from our wound team leader. So it really takes a group effort, and it really takes a shared vision to bring about real change. And so I just feel fortunate to even be a part of such a process. And so I just wanted to share this project, and I appreciate the opportunity to share this with you all. Thank you.